I'm called Dr. Harriet Babikako, and I work with the Child Health and Development Center, which is a department under College of Health Sciences, and I'm a lecturer there. And while there, we have different activities at the university. We are required to teach, to lecture. We're also required to do research and community service. So in terms of research, we have Child Health and Development Center has a child development and wellness research program. And under that program, we work with a team of diverse researchers, which includes social scientists, epidemiologists, and the pediatricians. So with that diverse team, we do a lot of research around child development, and we use different research methods to actually to try and bridge the gaps that are in the area. The area of child development is actually under-researched in our country. We have about 250 million children under 5 experience child development problems and delays, and that is in the countries that are middle income and low income. But the bulk of that, about 43%, is in sub-Saharan Africa. And yet, the problem is not even well described within our country. So our program seeks to fill that gap. So we seek to use research techniques, different research techniques to fill that gap. We seek to understand the epidemiology. We seek to understand the gaps in healthcare. We also do interventional programs so that we sort of mitigate the problems that would occur to the child if they did not get those interventions, child development programs. So under the program, we have, of course, funders. We've got some projects. We have some new projects that we have gotten this year. And one of those was funded by MACRIF. MACRIF Fund is a fund by government of Uganda and Makerere University. And so it funded one of our projects called, we are trying to, the project is called Family Rehabilitation, Training Communities to actually access rehabilitation services. Why? Because rehabilitation services are is a specialized service, and it is only offered at the Mulago referral unit. And so the idea to actually train community members to learn how to increase access to these services helps to bridge this gap. And so this is the program that was funded by MACRIF. We also have another program that was funded by ECF and the Elmer Foundation this year, and basically allowing us to look at the policies that are existing and edit them, and to make sure that they are actually helpful to the children who have neuro disabilities and wasting.